You've been told inflammation is the problem, but here's what your doctor didn't tell you. Inflammation isn't the disease, it's your body's alarm system. And if you keep silencing that alarm with ibuprofen and steroids, you're not healing. You're progressing through 5 deadly stages that lead to chronic disease. I'm Dr. John Kim, and today we're going to talk about something that changes everything: the 5 stages of inflammation and how ignoring stage 1 guarantees you'll end up at stage 5, where the damage becomes irreversible. And you need to watch this full video because the solution isn't another prescription. It's a protocol that addresses the root cause of why your body is inflamed in the first place. Let's start with what inflammation actually is, because most people, including most doctors, get this completely wrong. Inflammation is not your enemy. It's your body's intelligent response to a threat, whether that threat is an infection, a toxin, or damaged tissue. Your immune system releases inflammatory molecules, cytokines, prostaglandins, histamines, to contain the problem and start the healing process. That's acute inflammation, and it's supposed to be temporary. It shows up, does its job, and goes away. But here's where everything goes wrong. When the threat never leaves, when your body is exposed to the same triggers day after day, the inflammation becomes chronic. And that's when you enter the 5 stages. Stage 1, silent inflammation. This is the stage where you feel nothing, or maybe just a little off. You're tired, but you blame your schedule. Your digestion is weird, but you chalk it up to stress. Your sleep isn't great, but everyone's sleep is bad. Right. Here's what's actually happening. Your gut lining is getting damaged by processed foods, gluten, seed oils. Environmental toxins are building up in your liver. Your blood sugar is spiking and crashing multiple times a day. And your immune system is quietly releasing inflammatory cytokines like IL-6 and TNF-alpha. Your labs, they're still normal. Your doctor sees nothing. So you're told you're fine, but you're not fine. You're in stage 1. And every day you stay here, you're one step closer to stage 2. The tragedy of stage 1 is that it's completely reversible. If you eliminate the triggers, heal your gut, support your detox pathways, your body will stop the inflammatory cascade. But most people don't know they're in it. So they keep eating the same foods, living the same lifestyle, until stage 2, systemic inflammation. Now your body is screaming. You wake up with joint pain, brain fog that makes it hard to focus, skin issues like eczema or acne, digestive problems that won't go away. You're gaining weight even though you're eating less, and you're exhausted no matter how much you sleep. You go back to your doctor. They run the same labs, and maybe now your CRP is slightly elevated. Your fasting glucose is creeping up. Your liver enzymes are a little high, but still, you're told it's borderline. Nothing to worry about. Maybe lose some weight. Maybe exercise more. Here's the truth. At stage 2, your inflammation is no longer localized. It's systemic, meaning every cell in your body is bathing in inflammatory molecules. Your mitochondria, the energy factories of your cells, are getting damaged. Your insulin receptors are becoming resistant, and your brain is literally inflamed. This is where Western medicine fails you, because they're waiting for a diagnosis. They need your numbers to cross a threshold before they'll treat you. But by then, you're already deep into disease progression. Stage 2 is still reversible, but it takes more work. You need to address gut permeability, remove inflammatory foods completely, support methylation and detoxification, balance your blood sugar, and reduce your toxic load. This is where functional medicine shines, because we don't wait for disease, we reverse the process. By the way, if you are tired of being told your labs are normal when you know something is wrong, hit that subscribe button. We are building a community that demands real answers, and I want you to be part of it. Let's keep going. Stage 3, tissue damage. This is where inflammation stops being reversible in the traditional sense. Your body has been under inflammatory siege for so long that actual tissue damage has occurred. Your gut lining, it's not just permeable anymore. It's eroded. You have intestinal permeability so severe that food particles and bacterial endotoxins are flooding your bloodstream, triggering autoimmune reactions. Your joints, the cartilage is breaking down. You're developing osteoarthritis. Your arteries, the endothelial lining is damaged. Plaque is starting to form. You're on the path to cardiovascular disease. Your brain, neuroinflammation has damaged neurons. You're not just foggy anymore. You're forgetting things, struggling with depression and anxiety. Your pancreas beta cells are dying. You're now pre-diabetic or diabetic. At stage 3, your doctor finally has a diagnosis, but here's the problem. The treatment is almost always symptom management, not root cause resolution. They'll give you NSAIDs for the joint pain, statins for the cholesterol, metformin for the blood sugar, antidepressants for the mood, but none of these address why your body is destroying itself. Can you reverse stage 3? Yes, but it requires aggressive intervention. You need to eliminate all inflammatory triggers, heal the gut with therapeutic doses of nutrients, support detoxification at a clinical level, and often you need targeted supplementation to repair damaged tissue. I've seen it happen. I've worked with patients who were told they'd be on medication for life, and through a comprehensive functional medicine protocol, they reversed their markers, got off their meds, and reclaimed their health, but it takes commitment. Stage 4, chronic disease. This is where most of America lives. You now have a named disease, rheumatoid arthritis, Crohn's disease, type 2 diabetes, cardiovascular disease, Hashimoto's thyroiditis, a multiple sclerosis. Your inflammation is so entrenched that your immune system is attacking your own tissue. Your organs are failing, and your body is in a constant state of defense. Here's what conventional medicine does at stage 4. They suppress your immune system with biologics. They manage your symptoms with multiple medications. They monitor your decline with regular labs, and they prepare you for the inevitable progression. But here's what they don't tell you. Even at stage 4, you can halt the progression. You can reduce your medication burden. You can improve your quality of life by addressing the root cause. I'm not saying you'll reverse decades of tissue damage overnight, but I am saying that your body has an incredible capacity to heal if you give it what it needs and remove what's harming it. The problem is, most people at stage 4 have been conditioned to believe that disease is genetic, inevitable, irreversible, so they never question the root cause. They just take their pills and accept their fate. Stage 5, end-stage disease, this is organ failure, heart attack, stroke, kidney failure, cancer, dementia. This is where inflammation has destroyed so much tissue that your body can no longer compensate. At stage 5, the focus shifts from healing to comfort, palliative care, hospice, end-of-life planning. And here's the tragedy, this was preventable. Every single stage along the way was an opportunity to intervene. But because our medical system is designed to treat disease, not prevent it, millions of people march through these stages without ever addressing the root cause. So let's talk about the root cause, because this is what changes everything. Inflammation doesn't start randomly. It starts because your body is exposed to triggers it cannot handle. Trigger 1, the standard American diet, processed foods, seed oils, gluten, dairy, sugar. These create gut permeability and blood sugar chaos. Trigger 2, environmental toxins, pesticides, heavy metals, plastics, mold. These overwhelm your detox pathways and damage your mitochondria. Trigger 3, chronic stress, cortisol dysregulation, poor sleep, lack of movement. These create hormonal imbalance and immune dysfunction. Trigger 4, infections, chronic viral infections like Epstein-Barr, bacterial overgrowth like SIBO, parasites. These keep your immune system in overdrive. Trigger 5, nutrient deficiencies, magnesium, vitamin D, omega-3s, B vitamins. Without these, your body cannot regulate inflammation. If you want to reverse inflammation, you don't need another medication. You need to remove the triggers and support your body's natural healing systems. And this is why functional medicine works, because we don't just look at your symptoms. We investigate the root cause. We run comprehensive labs that conventional doctors don't order. We build personalized protocols based on your unique triggers, and we support you through the healing process. If this resonates with you, don't guess with your health. Click the link below to book a discovery call with my team. We'll review your case, identify your stage of inflammation, and build a roadmap to get you back to health. Or watch this video next where I break down why mold is silently killing you. You're not broken. Your body is responding to the environment you've given it. Change the environment, and you change the outcome. I'll see you in the next one.